how this affects our mental health. And we don't know how to look for those services because no one's engaged us in that conversation before. President Obama, in June 2013, says, "Too many Americans struggle with mental illness, suffer in silence rather than seeking help." And so Obama has been an inspiration to me to becoming more open about my own challenges growing up. I was told to respect my elders, do as I was told, not speak out, don't share how you really feel, or else you will be shunned, you'll be stigmatized. And so, but now I'm happier that I am able to articulate myself and advocate. And I appreciated Connie's presentation because she did already articulate what those barriers are in the API community. And I think that navigating the system, as I told you last year, is difficult. And there's not enough case managers out there. It seems that case managers are only for the lower income. But sometimes if people don't know how to speak English fluently, it's hard for them to find a case manager who will help them. The insurance companies, they don't have any orientation systems to be able to help people to figure out how to help themselves. I myself, this past year, have struggled at even trying to figure out my own health insurance private because it's emotionally triggering. I couldn't get myself to do that this whole year. As much as I'm an advocate, because I've also been a health navigator. I've had the opportunity through LA County Department of Health to be a part of Pacific Clinic's health navigation program. But at the API working group, I told them that it's a struggle even for myself as an advocate to help someone else when I don't even have a health navigator myself. All right, yay. And so how can I help someone when I'm not receiving the help? And it's last year I mentioned how I made over 60 phone calls to help me help myself. And I think that there needs to be, the hotlines need to at least mention the different support groups that are out there. Because when different agencies are filled up, their FSP slots are all filled up, and people have to wait. Well, what can they have in the meantime? What are their options, right? And so I understand that the system doesn't always have the capacity to help everyone, but at least give them the options of the support groups, because those are actually they're more affordable. And so, and from the health navigation program, I also learned that those with serious mental illness, they die 25 years earlier than the rest of the population. Not everyone knows how to navigate on their own, by themselves, and that's why they learn helplessness. They learn helplessness. No one's going to advocate for me, and it's a very lonely feeling. Because that's how I did feel in the beginning of my own journey for mental health advocacy. Before I found NAMI, before I found this committee, finding more mental health advocates. And over this last year, a year ago, I was recommending to the commission to, let's do more outreach and engagement events. And so I took the opportunity to hold 2 mental health awareness events, one in April and one in June. And I was very happy, Larry, that you were able to join us at that event where we had over 80 people there, and some of you were there as well. The second event, I got my first grant from Know the Sign Suicide Prevention Campaign, and I partnered with the Asian Youth Center, and they helped me to get over 150 Chinese-speaking people there. And I did that with the grant. And so after the event was over, they're like, when's is the next event. So there is a lack of funding to be able to outreach, meet the people where they are, because so many people are looking for services or don't even know where to find them. And so, and for all the efforts that I've made, I was very happy to get an award from Senator Ed Hernandez for Woman of the Year award. I even got to go to Alternatives and got the Youth and Peer Leadership Award, because I know the need is there. And I'm speaking out for those, my little brothers and sisters who are struggling in silence. They don't know